Okay, our recording has begun. I'm also going to drop into the chat a link to the user manual that we created. This user manual is from the perspective of HCA staff. And so this will be things that you guys can use and refer back to doing your work, understanding that this is was created for kind of the basic functionality of benefits 24/7, but and we will continue to keep it updated throughout time. So as new things come into are coming into benefits 24/7, we will make sure that that user manual is updated. And once we actually go live with benefits 24/7, I'm sure we'll find probably a better location to have that available. So stay tuned on that. Another thing I want to talk about up front, because I failed to talk about it until almost the end yesterday, is the purpose of this training between this week and next week is really to look at the basic functionality of benefits 24/7, which for the vast majority of you is going to feel, it should feel familiar to how Seb My Account looks, operates, but better. Um, and so that is really the purpose of these 2 weeks of training, is to go through how this benefits 24/7 works. We know that there will continue to be questions. We know that you guys are really hands in the trenches on the various cases and weirdness of accounts and things like that that come up. And so we will be having twice weekly meetings to host questions from any of you guys that you want to come in, and ETS staff such as myself will be available to answer those questions. I'm also going to be scheduling some time in April to kind of host a open house, essentially, I guess, to be available to talk through some of those tougher questions or situations that we know you guys may face. So, any questions about that before we jump in? Also, recognizing that there are some names in the room that probably don't know me. So, I am Amanda Neville. I am a business analyst who's been working on benefits 24/7. I've been a part of HCA for 4 years now. I started in outreach and training myself. So I helped do the training for when the SEB program was launched, and then moved over to ETS to work on SEB My Account, and now benefits 24/7. So wanted to give that brief little introduction for those of you who don't already know me. So let's go ahead and dive in. Um, so this is our login page for benefits 24/7, and I do want to spend a little bit of time here before we actually get into the application. And the reason for that is because it is a little bit different from Seb My Account. And the reason for that is because now that we have all of PEB organizations and SEB organizations coming in to use benefits 24/7, we have some requirements from the OCIO, which is a state government organization, that says if anybody who works for a state agency and is on something called the state government network, they need to be able to get into systems using Active Directory. And Benefits 24/7 is one of those systems that they need to be able to get in through Active Directory. And you may be thinking, what's Active Directory? If you're not familiar with that, um, a good a good acknowledgement of utilizing Active Directory is the Inside HCA page. So anytime you open your default browser, it should take you to Inside HCA, and sometimes it just takes a quick moment to recognize who you are, and that's because it's going through behind the scenes and saying, yes, you Amanda Neville work for the healthcare authority. You're within this network, so we can show you this inside HCA page. And so because of those requirements, our login options here for benefits 24/7 are a little bit different than my account. So this top login option is really for one, our employees, and two, our what we consider external admins. But this would be one, all of the SEB benefits administrators, because they are not part of state government. So they use SAW login, Secure Access Washington. This would also be things like our employer groups. And then there are some various state organizations that don't necessarily, they aren't on the active directory. But anybody who is not part of either HCA, us as staff working, so not our personal selves, but HCA staff, or folks who work for those state agencies using the active directory, they would use the bottom login. So all of us, when we're doing our work for outreach and training, I know we have Dina here from the audit crew. We have some other ERB folks with us. So any of us would be using this bottom login option for doing our daily work. However, all of us as employees making our own benefit elections, logging in during open enrollment to make changes to our coverage, etc., we would be using the top login button. This would be routing you through Secure Access Washington. You would use that SAW username and password to get in. So I know it seems kind of silly to spend this much time talking about the login page, but I do want to make sure that we talk about that distinction because it really is applicable now that we have HEB in benefits 24/7 versus just SEB in SEB My Account. So all of our SEB organizations and our employees and our employer groups for PEB will be using this top login option. This is a SAW login. And then the bottom is for us as HCA staff, helping to manage benefits, and then anybody in state agencies managing benefits.
Hey,
So,
Amanda,
yes,
I got a quick question for you. If a subscriber who's logged into their VPN, so they work for a state agency, have their VPN, clicks on internal admin HCA user, what
they won't be
happens?
able to get in.
Does it give
It's
them an
not,
error message?
I, I don't know off the top of my head if it gives an error message. We could double check on that, but I know at bare minimum, it won't let them get past the door here. In best case scenario, it would route them to SAW. But if you're logged in through VPN, it's not going to just let you log in with this
Right.
option.
And that's because, is that because the internal admin HCA user, it only recognizes those people who've been given a certain access?
Correct.
Right, okay,
Yep.
thank you.
Welcome. All right, I'm going to go ahead and pass the front door here. That was my access. Sorry, my access here was sitting for so long that it's being a stinker. Okay. We have landed on the dashboard. So for most of you, this should look pretty familiar to SEB My Account. And yes, I will be making comparisons back and forth with SEB My Account because I'm pretty certain all of you, if not all of you, then the vast majority of you have at least been in SEB My Account, most of you using it on a regular basis. So I do want to draw some comparisons and then some highlight some differences here within benefits 24/7. So just looking here at the dashboard, it should look, like I said, very familiar. We have our managed subscribers. We have managing access. This is for benefit administrators. managing organizations, dependent verification. This is for our extended, disabled, non-Washington state registered domestic partner dependent verification queue. We have our special enrollment event verification queue here. We have reports. All of these things to this point should be very familiar. One of the new differences here on the dashboard is an option for a self-pay dashboard. So this is a smaller condensed version of what we're seeing here, specific to our folks managing the retiree and continuation coverage benefits. So they kind of have a smaller subset of the dashboard to manage their side. We have application settings, which most of you guys won't ever need or want to see this. This is mainly for ETS staff to manage things like the open enrollment dates so that we make sure open enrollment starts and ends at the correct times. Posting any messaging on the front page of the application, like when we might need to take the system down to do updates and things of that nature. So application settings is really mainly ETS staff that will have access to that. Error handling is also mainly an ETS function, folks that will be using the error handling. And that really is because, again, as many of you understand SEB, since we have SEB My Account, and we know that Pay One currently is doing all of our invoicing and communication to the carriers. In SEB My Account, we have this nightly file that takes in all of the data that happened during the day, all of the plan changes and everything that happens during the day. And it takes it all in and it spits out one file at the end of the day and it sends it over to Pay One. And that's how all of the information makes it into Pay One or doesn't, because we know that happens too. And that's what errors are. And so with Benefits 24/7, we will be having that same process of a nightly file that goes over to Pay One. The difference being that Benefits 24/7 will be directly sending out files to the carriers. So we're used to Pay One sending out those carrier files every day. But now Benefits 24/7 will be taking on that communication to the carriers. But we will still be sending the data over to Pay One to complete invoicing processes. So this portion of the application is really for, like I said, ETS staff to see if we're having issues with records, and then it gives us an opportunity to resolve those issues and get them into Pay One appropriately. And I wanted to spend a little bit of time acknowledging that because I think it's important, while I'm not going to go into all of the technical aspects of what that looks like, I do think it's important to acknowledge how that communication flow works, because it does seem like a bit of a mystery, kind of behind the scenes that no one really has a great understanding of. And so I just wanted to shed a little bit of light on what that looks like, and especially as you guys see what this error handling thing is on the dashboard. Last but certainly not least is the subscriber enrollment history tile here. Now, if you have already seen the current SEB audit report, also called the benefits reporting tool, also called an appeals report, however you may refer to it. The the current version for SEB is a standalone website that we log into. We can search for a subscriber and we can look at all of the changes and things that have been done on an account. We can see when somebody is logged in, etc. We have moved all of that into Benefits 24/7. So when Benefits 24/7 launches, any changes that happen from that point going forward, which is May 8th. May 8th forward, any changes that happen in benefits 24/7, we'll be able to go into this subscriber enrollment history, search for a subscriber, and actually see those changes. Not only can everybody in HCA see that, one of the big changes that we made for benefits 24/7 is to make this subscriber enrollment history available to the benefit admin. So we are well aware that that has been many, many, many phone calls, many, 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 many fuses. We don't understand. We don't know who did this. The subscribers telling me they did one thing. We're seeing another thing. Can you help me? Do you have an ability to see this? Now we're going to give the benefit admins the ability to also see that right on their own benefit admin dashboard. So we will look at that history and what it looks like after we've made some changes on an account. So this is the dashboard. Do we have any questions now before we jump into the fun? And I should say, feel free to jump in at any point, ask questions. You can also ask questions in the chat, which it looks like people have already started doing. Jessica Pratt McConnell is here and she is taking notes for anything that arises during our training today. And also have Jeff Grobner here, Brandy Brown is here. They are here and available to help answer questions as well. So with that being said, I am going to jump in and we're going to just walk through the process of going into an organization, adding a subscriber. We're going to really look at what's the same, what's different. So let's go into our manage organizations. So you will notice this again looks very similar to how My Account is laid out when you go to manage organizations. However, because we now have all of SEB and PEB in one place, this list is much, much, much larger. So what we did was we made an ability to filter. So we have these buttons here at the top. You can select to show only PEB, or you can select to show only SEB. So if you're looking for, and this is my favorite one to use. So let's say that you're looking for a SOTN and you only want the SEB school district. You can select the show only SEB. You type in what name you're looking for and you hit search or you just hit enter, and you will only get a result for a school district. Now, if I was to unselect the SEB option and I hit search again, now I'm going to see all of the organizations with that name for both PEB and SEB. Same goes if I select PEB, hit search, now my SEB option removes. So it's just a way to easier view this very long list because we do understand there is a lot of organizations. You can also use these filter options here. If at any point, let's just say, I mean, you can use the search or the filters. It's either or, whatever is your preference. We give you lots of options to find what you're looking for. So I would like to go into, I am going to go.
Amanda,
Yes.
Amanda, before you go too far,
Yeah.
just a quick question. Employer groups come and go. If we have a termination date in there, will they drop off that list?
Yes, I believe that they would.
Okay, thank you.
Welcome. All right, I'm going to go for Fish and Wildlife today. That's where we're going to start. So search for my organization, select and manage. So now I am on the organization dashboard. Again, very much like how My Account functions. Because this is a PEB organization, you have specific tiles on the PEB organization dashboard. So we have managed subscribers, managed access, organization profile, dependent verification, special enrollment verification, reports, the data depot, which will be, I guess all of this is new for PEB, right? And then that subscriber enrollment history. So when we look at STEB, a STEB dashboard, it will be a little bit different. And let's just go ahead and pull one up so you guys can see the difference. We have for SEB organizations, we have that ability for the eligibility file for them to do a mass upload of newly eligible folks. So they still will have that ability to use the eligibility file. And they also get their billing files through Benefits 24/7. So that tile is available to them. And neither of those options are on or are available for our PEB organizations. So a couple differences there between PEB and SEB dashboards. All right, let's go back to our fish and wildlife here. And I am going to just go ahead and add a new subscriber because I want to walk through some differences than how my account looks. So I'm going to go. We're going to do a date of eligibility of March 1st because that's a pretty cool day. All right, so we're going to go ahead and if I could spell first and last name, just like Sub My Account, anything that has an asterisk is a required field. And we'll just go through here, first and last. Social is auto-populated from the first page where we entered their SSN and date of eligibility. So at this point in time, if we were to see that and it was not correct, we would actually need to just go ahead and cancel and then start over before, instead of just being able to correct the social at this point. You also see that the date of eligibility is the same. You cannot edit it here. And the biggest reason for that is we also added this coverage effective date field. So this is also read only. This is not something that we have in Sub My Account currently. And I will say this has been a huge request all along the way is we don't know what their coverage effective is based on the date of eligibility, or said benefits administrators were putting in people with, let's just say, a March 1st date, expecting that that gave them coverage March 1st instead of coverage the following month. So if either the social or the date of eligibility is incorrect, they would need to just go ahead and cancel and start fresh. This person hasn't been saved at this point anyways, so there's no harm, no foul. But recognizing that this is a little bit of a change from how Sub My Account currently works. So go ahead and put in our sex and gender identity here. Our eligibility reasons. One thing I should say, you guys see that I have highlighted this box. You're probably wondering why you don't see anything in the drop down. I see things in the drop down. I don't know what it is between, I don't know if it's a Teams issue. I'm not certain why the drop downs don't show when I'm sharing my screen. So I will, when I open drop downs, make sure I relay the information to you guys. So this eligibility reason, when I open up the drop down, we have newly eligible, return from layoff, return from leave without pay, return to work, faculty, and seasonal. So those are our options here for the eligibility reason. This is just going to be a newly eligible member. We also have, is this employee represented? So this is if they are under a bargaining unit. If we select yes, the effective start date is required. So I'll go ahead and enter that date. Employee eligible for LTD. So we know that the only employees not eligible for LTD on the PEB side of the house are seasonal employees, and port commissioners, and also medical only groups, of course. So if for some reason somebody is being added, that the port commissioner or seasonal employee, wanting to make sure that that is changed to no, but yes is the default response for LTD eligibility. We also have a gross salary is required to enter for PEB organizations, since we do bill for that LTD coverage. We do require that salary to be entered. Not new information to you guys. And we have a hire date. So this person was hired and eligible, and their coverage started all on March 1st. What was I? There was something I was thinking in regards to the salary, and it popped out of my head. So if I remember it, I will circle back around. Okay, so here we have mailing or residential address here. We also have the option to put in a mailing address. If they don't have two separate addresses, we can just select the checkbox and then that mailing address goes away. I know what I was going to say. And I see that Miss Debbie is here today. She was the one that brought up this question. So right now I am adding a subscriber to a PEB organization. This is a state agency. These folks are typically going to come across on a on the HRMS files. HRMS file, is that what I want to say? We're going to be receiving this information. It's going to go into what I like to call a holding cell, where we're going to essentially get the demographic information um, for individuals who are part of a state agency. However, on that file that comes into benefits 24/7 and goes into the holding cell, we don't actually know if they're eligible for benefits or not. So it is still the responsibility of the benefits administrator to go in and add those folks as eligible for benefits. When they go into that first screen and enter the social security number and the date of eligibility, they will get a notification that this subscriber record has been found. We do have that information, and you can go ahead and claim that. So it will provide the first and last name and the social security number, and you can say, yes, this is who I'm trying to add. And it will have some of this information already pre-populated based on what we've received from HRMS. So I wanted to remember to acknowledge that today because Debbie did remind me of that yesterday. So I'm going to go ahead and put in my address here, and we're going to submit. All of this feeling very familiar. Once we've completed our subscriber ad, of course, we come back to the manage subscribers page. And then now I'm just going to go ahead and search for that subscriber. I'm going to select my fish wildlife here and manage. And now we are going into the managing that subscriber. So this is where I like to highlight some differences. Because we're in as HCA staff, we're into the organization that we're managing, and even further down, we're managing a subscriber within that organization. We are seeing the subscriber dashboard here. So this dashboard, if I was to log in as Fish Wildlife, this is all I would see on my dashboard. I would see the newly eligible option here, and I would see profile and current coverage. That is all the ability I have to do at this point in time until I walk through my newly eligible. And so that is a bit of a change from Seb My Account, because we were giving them the ability to do anything and everything, caused some overlapping SOEs along with newly eligible things that were just a little bit confusing. So really what we're having them do is, hey, you're eligible for these benefits. Go ahead and walk through this process first, and then we'll let you see all of the other things. all that to be said, because we are in as HCA and we're in the viewpoint from the organization, so this is what a benefits administrator would see. The benefit admin does have the additional tabs to be able to look at. So something like the eligibility tab, if we select the eligibility tab, this has been renamed. Instead of my account, it says employment, but this is the eligibility page. So if we come in here, we see all of that demographic information, their eligibility information. This is where we would come in to complete a termination or a transfer, update an address, etc. And we will get a little bit more into terminations, transfers, all of that stuff next week. So I'm going to head back to the dashboard and we're going to walk through newly eligible. We have been calling this a wizard. It's a little bit more friendly, a little bit more helps you walk through the process than Sub My Account does. So I don't know, newly eligible wizard just sounds kind of fun. So here it's going to ask, do you have any dependents to add to your account? So if you don't, obviously you select no and you just continue forward. But for today, we are going to add a couple of dependents to the account. So I'm going to select yes and hit next here. And we have some information about eligible dependents, being links out to various websites on information about those dependents. And then we can start diving into adding I'm going to add a spouse first. Oh, birthday. I was doing what happens when I don't pay. I'm not looking at the field that I'm typing in. I'm so used to doing certain things certain ways. So birthday, birth sex, gender identity, and then we move into our relation. So I am adding this person as a spouse. When I select spouse, partnership start date does appear. So let's go for May 1st. My qualify reason, I have option married spouse, non-Washington SRDP, and a Washington SRDP. So I'm going to select married spouse. Now I can do that social. And then of course, if our dependent has a different address than the subscriber, we can enter that here. I'm just going to go ahead and select it's the same. Now it's going to ask me or move me on to adding coverage to the dependent. So here, because we're in PEB, it's asking me what benefits would you like to enroll in? We have medical and dental options. If I was to only select dental, it's going to say proceed to dependent review. However, if you look down below and these grayed out options, you do see tobacco attestation and the spousal attestation. But this button right now is telling me proceed to dependent review. And that's because neither of these attestations are required if the individual is not enrolled in medical. So once I select medical, now it's saying, hey, let's go make your tobacco attestations. So I'm going to go ahead and move to tobacco attestation. We have some information, and then here we just select yes or no. I'm going to select no. And then it tells us now we're going to continue on to the spousal attestation. And then here we do have the intuitive questions. So they will populate as soon as you hit yes. The next question will populate until you hit no, at which point now the final question is no longer selectable. It's auto defaulted to no, and then you can move forward. If I continue to question 6 as a yes, of course I have the ability to select yes or no. Here I'm going to go backwards. We'll just say no to question 2. Now I'm going to move forward. Saying I will not pay the surcharge. And now it's telling me, please proceed to the dependent review. So here it gives me just a little overview of the person I have just added onto my account, date of birth, what kind of dependent they are, medical, dental enrolled or not, and then the surcharges if they apply or not. Once that's done, we save and finish. And it says you have successfully added your dependent, and it provides their name. Do you have additional dependents to add? Yes or no? I'm going to add one more dependent, and I'm going to say next. And I think, looking at my list here, I had the disabled dependent folks in our training yesterday. So I made sure to highlight the disabled dependent for them. I am going to add an extended dependent today and show you guys what that looks like. So we will say, and select these. Okay, so I'm going to select in my relation. I have child, extended dependent, spouse, or SRDP, or stepchild. I'm going to select extended dependent here. My qualify reason is automatically populated, and it is not, I cannot change that based on what my relation is. As soon as I selected that extended dependent, you see here that we have additional language that's populated on the screen. It is one chunk of language that displays for either a disabled dependent or an extended dependent. So this first paragraph is really focused on the disabled dependent and submitting a certification. After that, it does talk about if you enroll an extended dependent, you have to submit the certification, and it provides a link to that certification form. So then we will do enter their social, and here again, I'm going to keep the address the same. So let's gonna proceed through this a little bit quicker here since we've now seen this. Based on my date of birth, for my dependent, it skipped over the tobacco attestation since we know it is not required since they are not over the age of 13. So we didn't even need to look at it. I'm going to go ahead and hit save and finish now. And at this point, I am not going to add any additional dependents, so I'm going to go ahead and say no and select next. It's going to just give me one more review to show me who I've added onto my account and what coverages they're enrolled in. And then it provides me some information here and an opportunity to review what dependent verifications documents are acceptable. Now it's going to move me into the document upload section. So here it's going to provide a lot of information about what eligible or what documents are allowed by dependent type. So we have spouse, SRDP, children, and then we have the ability to actually upload those documents. So I'm just going to go ahead and select the file here really quick. And as soon as I select that file, you see it display below. And then we have the new section to actually associate those documents and who they're going to apply to. So I'm going to, in my document type drop down, we have all of the allowable dependent verification documents, such as marriage certificate, tax return, birth certificate, etc. So I'm going to select tax return in this scenario. And then I'm going to apply that to both my spouse and my extended child. Which
Can I ask a quick question?
Yes.
Okay, so on the extended dependent, I have a question about that certification form because they're supposed to submit that with their enrollment form, right? And this is an online enrollment form. Do you want, or should we tell people to like upload those certification documents, like the PEB form here? Or where does that, how do they get that to their PEB employer, if it's like the employee doing it, how do they upload that, or where are they supposed to? I'm not clear on that.
I was waiting for Amy to speak up because I know that that process is largely on her.
Oh, okay.
Yeah, the employers have nothing to do with certifying an extended dependent. So what will happen is if they upload it here, they're going to show up in the tile
Yep.
Under the organization for certifications. And that's where my staff go and look for any extended forms to certify them.
So when the employee, say the employee's doing it, right? And there's that certification form, the PEB form they have to complete.
Mhm.
What is there, like, is this where they upload it, Amy?
Yes.
Under this select files? Okay, is there, what would they click under document type?
They could select. There is court order. What are the
Yeah, that's what
other?
that's what it should be, is a court order.
Yeah. Court
But
order, guardianship. Yeah.
but when they label it as an extended dependent or a disabled dependent, that's when it triggers the tile on the HCA dashboard to actually load it, the information there, and then we just go out, and the extendeds don't have to be verified, they just have to be certified, because the
Okay.
court order works as the dependent verification as
Right,
well.
right. So, but this is where they would upload that form for you guys,
Yep.
right? Okay, that's all I was curious about. Thank you.
We could, if business wants it, since we do provide the information when they're adding an extended dependent, that we give them a link to the extended dependent form. We could provide that as a, as something as an option to upload, because say maybe they have a court order and the form, and they upload two things and they want to designate one as the form. We could do that if you want.
As a doc type, is that what you're talking about, Jeff?
Yeah, it's just a doc type in the menu drop down. That's real easy. If
That might be. It might prevent any confusion on the employee's part.
Okay.
They have the certification form, they have the court order.
I will make a note.
Thank you.
You're welcome.
All right. Great questions. Thank you. And we will look at where those extended and disabled dependents show up for HCA staff to work. So, all right, I'm going to go ahead and hit upload and confirm here. And then it, of course, gives confirmation of proof of eligibility. So we're just going to proceed to elect coverage now. So here, I would like to point out a couple of things before we move forward. So this is for a PEB organization. So this is showing all of the available plans for that person. Now, of course, in SEB, it's going to show anything that's applicable based on where they live or work. And so plan availability might be a little bit different. However, there are circumstances that may arise where we need to do an allowance on a certain medical plan as HCA staff. So we have this separate button up top that says see all available medical plans. And if we do that, again, this is only something we can see as HCA. If we select that, now I can actually see every plan that is available within the PEB program, including those Northwest plans that this individual should not have available to them. But if for some reason we needed to do an allowance, we have that SOE for a continuation of care, something of that nature, we'd be able to go in, select this box, and apply a plan to them that wasn't previously available. I'm going to unselect that, and we will go ahead and enroll this family in Kaiser Sound Choice. We also have the Waive Medical checkbox down here in case they are going to waive medical. I'll select next. We have the dental plans that are available. Want to point out that if I select uniform, we just get the next, but if we select Delta Care, we do provide a little bit of an additional message in big red letters letting people know you'll have to select it. This has been in my account for a little while now, but this has been a big issue, as we're all aware, between these dental plans. So we'll go ahead and stick with uniform for this person. And now we get to the confirmation page. This is where they would see their plan alerts. If the plans they have selected have different alert messages, in this case, the Kaiser Sound Choice, this is the plan alert for that. And then it shows any of our subscriber independents, when their coverage would begin and what plans they are enrolled in. So it just gives an opportunity to review that. Now we can move into the subscriber attestation here. Give some information about that surcharge. We're going to select next. And then we're going to go ahead and say no, they are not a tobacco user. Review the legal information and submit. So it says now we're going to view our supplemental coverage options. So here we move into the long-term disability information. So as we look here at the options, of course, we have the 60%, the 50%, or declining that coverage for the employee paid. When I mentioned earlier adding that PEB member and entering that salary, which was a required field, it's kind of cool because it does show them on the LTD enrollment what their potential benefit amount could be. We do have a request in for update to this language. However, it also does show them what their monthly premiums would be based on the plan selection as well. So for fun, we'll go ahead and select the 50% option today. Of course, some information about life and AD&D, links to get to that information, flexible spending arrangement, dependent care, links to get to Navia, lots of information, more information about the HSAs and Smart Health, and then of course, auto and home insurance as applicable. Now we're going to go ahead to continue and review. And this is a really fun change from My Account, is we actually are showing them on screen what the summary of coverage elections is. So we can actually see it right here before we ever even finish what we're doing. We can see who we've enrolled, when their coverage is effective, the plans we've selected, what our monthly premiums look like. And we'll go ahead and select next here. And then we have that information about the life insurance and the long-term disability. And then go ahead and select next. Now we have our final legal notice here. It does require us to scroll through and then hit confirm. So now we get a little message at the bottom. You have successfully completed your newly eligible. You can download that summary that we just looked at. It is going to look very similar to what we saw on the screen, a little bit smaller font, but that gives them the opportunity to download and keep for their records, always important. And then once we are done, we can of course sign up for emails here. We can go back if we want to make changes. We can also select any one of these to go back into those section and make changes as well. But I'm going to go ahead and go back to the dashboard, because now you can see, since we have finished the newly eligible, we now have the special open enrollment and account changes tile. We have our managed dependents tile, supplemental coverage, and then a retiree and continuation coverage tile. So now that we've completed that, it allows us to have the additional options on the dashboard.
Amanda, I have a question.
Yes.
So it has to do with long-term disability.
Okay.
When we noticed on the employment tab, when they enter the salary in, there is no date field as to when that salary was effective. We do a lot of retro salary changes. where we have to put a date in, and then it has to be manually sent up to accounting, and all of that is a manual process to go back and rebill them the new amount, the difference from what they were paying to what the change was. But we didn't notice a date field on the employment tab where we put the salary.
You're right, there is not a date field. So we will take down that information and we will touch base with you further on that, because I would love to know some more information.
Okay.
So we'll have to be in touch.
All righty. Thank you.
Welcome. Thank you for asking that.
Amanda, on that last screen where you hit the continue button, it looked like it was a grayed out button. Was that just a weird view?
So the colors in the training environment, the purples and stuff, this is not the final color scheme. So the buttons where things are grayed out and such, yeah, one's
It'll look
benefits
like a live
24/7.
button.
Yes, they will not look
Okay.
like they're disengaged. Great
Okay.
question. All right, so now that we have walked through the newly eligible, and I know this stuff probably seems a little things that we're pretty used to, but I do think it's important to walk through this because there are some changes to the way that semi account functions and such. So I wanted to make sure we highlighted that. All right. So, of course, if we need to go in, I know a lot of you get contacts, outreach and training folks get emails from the carriers, and we need to make changes to demographics for either a subscriber or a dependent. Say we have a date of birth that's incorrect or a social security number that needs to be updated. Of course, for a subscriber, when we go in and manage that person, we can go to their eligibility tab and we can make an update to their social. Now, I will point out, because you're probably wondering, hey, Amanda, you just told me we could make an update to their date of birth. I also talked about at the beginning of all of this, when we have a state agency who we receive data through HRMS, there are many of these fields that we cannot make the changes. And that's because the information that we're receiving from HRMS is the system of record. So something like a date of birth, if it's incorrect, that needs to go to the agency to then update and send over to us, because they are the system of record for that
What's up,
information.
girl? Oh, you like
Jeff.
Oh, sorry, I'm stuck on my cat.
Muted him. That scared me, to be quite honest. So you'll see a lot of these fields that are locked down and uneditable for state agencies, but for non-state agencies, you'll be able to make edits for all of these fields, other than a date of eligibility.
Amanda,
so we could make, yep.
Sorry. So on the organizational profile in the database, I have them marked whether they're central pay or SA for state agency, which means they are a state agency, but not on HRMS. Did we carry that over? Sorry. So that staff know which agencies we can change demographic information on and which ones we can't.
I am certain that we do.
I thought I saw it, but I just wanted to double check.
So we have if they're HRMS or not.
Okay, there's a yes. Okay, that's all
Yep.
they need is just some sort of flag to double
Okay.
check before they start making changes. Thank you.
Yes, and then up here, central pay. It's like, I know it's in here somewhere. Okay, I'm gonna go back into my person here. Great question. I appreciate all of the questions. Okay, so we looked at how we could update subscriber, and then of course, if we need to update a dependent demographic information, we go to the manage dependents. Here you can actually see, because we have not done anything with verifications yet, that we have a pending verification for the spouse and a pending certification for the extended. So if I got updated information for this dependent, I could come in here and let's just say this was actually meant to be a 1, and then this was actually meant to be a 2. We can update those and submit our changes. Pretty straightforward there. You can also see certification information right on the dependent page here, where more on that, because we're going to talk about that here in a moment with the verification. So we've looked at now how to update demographics. So let's go look at dependent verification. So I'm going to stick within fish and wildlife here for a moment. So we now have one verification request for dependent verification. So if I select our spouse here, of course, we can look at that tax return that has been provided and say, yep, checks off, checks off, checks off, good to go. And then we can verify. We have our same verification statuses that we have in SebMy account, the same ones you guys are used to using. Verified, verified not Washington registration, verified Washington registration. Date auto populates to today's date. And then of course we have our allowable document types, which you guys can't see, but they are the DEERS registration, J1, J2, marriage certificate. In this case, I'm going to select tax return. So I'm going to go ahead and submit. Pretty straightforward, right? So you're probably thinking, well, they had another dependent, but it was an extended dependent. And yes, they did not show up in the queue. And that's because one, extended dependents don't require verification. They only require certification. So if I go back to my HCA dashboard and I go to the main dependent verification queue, here is where we will see now any disabled or extended dependents that are pending certification. And so I am going to go to the next page. So here we see our extended dependent that we did add. If I expand this, and there are many people in the training environment already that have been playing around, as you can see, adding people, which is great. So here you can see that because it's an extended dependent, we have verify already selected. They don't need to be verified for being a dependent. We just need to certify them. But for our record keeping is kind of behind the scenes, we have them selected as verified. But what we can do is come in here and now add that certification. So very similar to SebMy account, when we come in here and expand the certification section, we select add new. Because this is an extended dependent, our only option in the dropdown is temporary. If this was a disabled dependent, we would actually see temporary and permanent because they are allotted permanent certifications. So here we can then put our start date and our end date and hit save. So now that certification has been added.
Amanda, could you expand that again?
Yes.
Thank you. So pay one actually requires something be in the DV field, and usually there's an option on verification for a court order. So staff fill that in so that the dependent shows verified, they get enrolled and all that kind of stuff. Is that a requirement in here? And will that need to go to pay one because letters go out? And I assume the letters are still going out from pay one.
Can
Jeff?
I pipe in?
Oh, yes, please.
Pay one for an extended dependent does not require DV.
I thought it had to have something in the DV field, which it was typically court order. April, can you help me here? April. Didn't hear you if you're
Yeah.
talking.
A1 doesn't have an DV requirement for extendeds, only
Oh,
for
okay. I
disableds. Yeah.
thought it did. I thought that was part of our problem with letters not going out.
Nope.
Okay. So it was another problem with the letters not going
Yep.
in. All righty. Just want to be sure they get their letters, because we have spent the last 3 years cleaning up messes because people never got their letters to recertify and their kids have been off coverage for a while.
Oh, goodness.
So,
Thank you for
all
bringing
right.
that up, though.
Yeah, I just want to be sure it's we're covered here.
Yeah. Thank you. The other thing that we have in here is this little status. And we already logged from our training yesterday an enhancement request to do some additional work on this status so that when the certification has been added, we have a temporary certification added. Once that has been saved, the enhancement to benefits 24/7 is that this status will, as I like to say, automagically change to approved. Unfortunately, right now, and by the time that we go live in May, that automagically process will not be quite in place. But what we can do is come in here, and really the purpose of this status, and I think ultimately what we will end up doing is having a bigger conversation with some folks who are well versed in extended dependence and disabled dependence, and really talk about how important this is, and if maybe we work on the auto magic of showing the correct status, or if we just remove this altogether. But the purpose of creating this was to then display back to the subscriber, if they log in and look at those dependents, they could actually see the status of their certification. So it would give them an opportunity to see, like, for example, if I change this to approve and that I reviewed it on this date, once I save that, then this information would display to the subscriber when they go look at their dependent. So more to come on this. We'll be having some conversations about that in the future, but did want to acknowledge that that's what the status field was for. I'll just go ahead and submit the changes there. They have now been removed from my pending request list. So this is, again, as I mentioned, the queue for all of the disabled and extended dependents will show up in this section. And I'm going to select Mick Jagger here. Debbie, I like the reference. I just want to point out the difference. And of course, you guys won't be able to see my drop down, but because this is a disabled dependent, when I do an add new for a certification, I do have that option for a permanent in addition to a temporary, which we didn't have for extended, and you'll just have to trust me on that since you can't see my drop downs. Any questions about dependent verification so far? This show only pending works the same, just like it does in Sub My Account. If you unselect that box, then you can see all of the requests, whether they've been verified or denied or they're still pending. So that's how you can really get in here and get to the any requests that have already been verified. Of course, using filter options, you can also filter and just look for the person you're looking for, all things that we are probably familiar doing. So I am going to I'm just going to go to my main subscriber search here, and I'm going to pull up my fish, wildlife, and manage again. And I want to point out the notes section. So for managing PEB, we are used to using Pay One, of course. And then if we make changes to the account or we've talked to somebody and we need to make a note on that account. We're used to using the 58 screen. Now we want to make sure that those notes are input into benefits 24/7. So we do recognize that I want to be clear, any notes that are currently in pay one on the 58 screens for anybody will not be brought into benefits 24/7 when we go live. So those will continue to be visible in pay one. However, if we do anything on accounts and benefits 24/7 going forward, we do want to make sure that we put the notes in benefits 24/7. Also recognizing that sometimes we need to leave notes for accounting folks that they need to see something. So if we input something in the notes page in benefits 24/7, we may need to copy and paste that note into pay one. I would really probably leave that workflow process up to supervisors on how you want to ask folks to do that, but recognizing that benefits 24/7 is the system of record, and we need to make sure that notes are captured into benefits 24/7. So really as simple as selecting add note, and then I'll just say, hello, I managed this account today. Obviously, this is not a note I would typically leave, but for the purposes of today, I'll input my note and hit submit. And then now we see that note when it was created, who created it, and what the note actually says. So pretty similar to how they're displaying in My Account. Which brings me to another point. As we've talked about, all of the things that are similar, different, changing. One of the things that you probably did not hear me say was account corrections. There is not account corrections for benefits 24/7. So hence why you saw, for example, the notes on the actual managing the subscriber. We have incorporated different ways in which to manage subscriber accounts in benefits 24/7. Also recognizing that many, if not almost every, there's always going to be things that come up, but we have taken into account all of the various problems that have occurred in My Account that cause us to use account corrections, and have made sure that benefits 24/7 either doesn't allow for those things to happen or has different ways to handle those things. So there is not account corrections. We will be going over how to actually correct accounts or submit a correction event, as we like to call it, next week. That's something we'll be going over. Any questions about that? Any concerns about not having account corrections? I myself am pretty excited about that. I think we really have come a long ways in recognizing all of the various issues we have in SEB. So, okay. The next thing I am going to talk about is benefit admin access and provisioning that access. So there are, of course, two different ways to manage to manage providing access. There is the perspective of doing it through an organization. Benefit admins can provision access to their own coworkers at various levels, but there is at least one person on what we like to consider an admin level that we need to provision access for them. And so I know many folks are working through that process as we speak. However, I do want to acknowledge that I want to talk about the different ways to add the access and why it's important to really utilize this manage access for benefit admins through our admin dashboard. So I'm going to start out by going to, let's go to Arlington School District here, and I'm going to manage the organization. So Amy helped me remember that there is a PEB organization that helps administer benefits or eligibility for many different PEB organizations. But we can also think of it from the perspective of SEB, how we have the ESDs, and we might have an ESD staff person who helps manage benefits for many different school districts, such as my easy example is ESD 113. That's the local one here in Tumwater. And let's just say I am a staff person there and I manage benefits for PL and Raymond school districts. I don't even know if Raymond is an actual school district, but let's just pretend. I manage benefits for 2 different districts. And so we want to make sure that that one person has access to both organizations with only one login. And what I'm going to show you right now is trying to add somebody to an organization through their, so I am in Arlington School District right now, and I go to their manage access. And I can add a system user. Of course, we have some information about the various access roles here. If I add system user, and I'm going to go ahead and put my name, my email, and I'm going to select edit, and I'm going to put that my access starts today. And oops. And I'm going to hit save. And you'll see that a system user already exists with this email address. So it's not going to allow me to save this person. Now, if I'm adding, because it's telling me this person already exists in the system. So hold on to that thought. Now I am going to add somebody different and show you. So I'm going to add Brandy to Arlington School District, and that did successfully save. Now Brandy is in the system. We also, this was a big ask from SEB organizations, especially some of those that have had many changes in their benefit admins. We have this new inactive users drop down. So if we expand that inactive users section, anybody who's actually had their access ended, and if we save that, they will display down below. So let's be mean and just revoke Brandy's access right away. Now she no longer appears in this active users section. Brandy appears in the inactive users section. We even then have the ability to just fully remove her, but we can keep her in this inactive users section. So that is a little bit of a new feature. Okay, so I tried to show you adding myself to Arlington School District and I got an error message. So what that tells me is that if I'm trying to add somebody into a district or we get a call from a benefit admin and they're saying, so-and-so is trying to add me for access and benefits 24/7 and we're getting an error message. Where we want to go from our dashboard is the manage access page. And we come here and now we can search by the organization name, a first name, a last name, an email address. What we can do is just actually, I'm going to search for my own email here and I'm going to hit search. And now it's telling me, hey, we already have this person in here and they have access to Bellevue College. So when I expand this record, I know that I want to be added to Arlington School District, or let's pretend I'm not actually talking about myself. Amanda Neville needs to be added to Arlington School District. So we expand her record. We select add access role. We're going to search for Arlington in the drop down. we provision the correct access level based on the information we've been giving. In this case, edit access for Arlington School District. And today's date is auto-populated. You can go forward. There's no need to go backwards, but the date does allow you to go provision access in the future. And then I can just hit save access. And then now you can see that my login has Bellevue College and Arlington School District attached. And this, again, is really so that our benefit admins, when they're logging in to Benefits 24/7, if they're managing multiple organizations at one time, they will have a drop down at the top of their page and they can actually select those different organizations. They don't have to use many different emails and many different login options. They can just have all of their access on one account. So I know that we've already been doing this in SEB, but it wasn't as clear and we didn't restrict folks' emails from being added in multiple times. And so we've had a lot of problems with people not getting access to the correct organizations and things that they were looking for. Any questions about the access? You guys are so much quieter than our group yesterday that I've already completed everything we talked about in the first session.
I do have a question. It doesn't really pertain to this, but it's something that I'm working on right now. So, this database for SEB, when you go into like manage addresses and things, because I'm particularly touching mail, the PEB database has like a print label button that allows us to print whatever agency like I'm doing mail for, just like print a label straight to the dymo. This program and the SEB program, I haven't seen that button exist. Is that something that we can put in? Because it does create a huge relief in the amount of work that I do in these agency mailbacks.
We can definitely take that request down. It's something that we would have to talk about and really understand the information and the requirements for. It's
Of
not
course.
something that's been brought to our attention up to this point, but we would be happy to take that down and work with Alyssa Richards, our product owner, to understand how and where this falls into our priority of updating benefits 24/7, but certainly appreciate that request and we will definitely look at that.
Absolutely. Thank you.
Thank you.
I mean, I just want to expand on that a little bit for Laura. So if you do that in Pay One today, you can continue that in the future, at least for the time being. But obviously, if you're in Pay One and you're making changes, we would want you to do that in the front end system. But you can
It's not
certainly
Pay
still log
One.
into Pay One and
Yeah, I
print the
was going to
labels.
say,
It's not
I know,
Pay
you can't
One.
change
that they're
address.
using.
What'd you say?
It's my access database that'll be going away because
Oh.
of all the profile information being in here.
Yeah,
I
so
missed
it's
that.
not Pay
Mind.
One, it's the SEB My account where we log in as an employee. When I go in to like mail stuff to these agencies, I'm not necessarily changing the address. I just go in and copy and paste it
Okay.
to a label. But
Sorry,
it's
I
a
missed that.
lot of
Yep.
work. Oh, it's
I thought you were
okay.
talking about subscribers, not agencies. Never mind. I was way off.
That's okay. Yeah, it's just like today I had a huge stack of agency mailbacks, but everyone SEB in this database, I have to copy and paste. I have to go into every single school district, copy and paste to a label, print the label, and then I can mail their stuff out. And when I'm doing PEB, the program allows a little button that says, print label, and it generates an address label for the one that I have open. And it's the most helpful thing I've ever experienced. Like today, this mail is going to take me probably an hour or two longer than what it would have regularly if it was PEB.
Yeah, we will definitely take that down and work with you on understanding more information on that.
Thank you so much.
Thank you. Yes, James.
Yeah. So on the screen, is this kind of you're taking a pause for any questions?
Well, so here's my thing. Because we're kind of mirroring the same session that we had yesterday for today, and then we'll have the second portion next week. I really don't want to move ahead of where we wrapped up yesterday. So as far as what we reviewed yesterday, we have completed all of that information today because we had a lot less questions.
Except
So
for history. You haven't shown history to this crew yet.
probably because it was being silly. Okay, let's go
Sorry.
ahead. James, I'll take your question and then we can look at the history. Thank you, Amy, for keeping me honest.
I can wait if you're on a roll, but
Okay.
I have a question if you want.
Okay, let's go look at the history really quick and then we will get to your question.
Thanks.
Okay, so subscriber enrollment history. We can get to it from our admin dashboard, or again, we can get to it through the organization, but let's just go ahead and select it from our dashboard here. So again, same search criteria as everywhere else. I'm going to go ahead and type wildlife here. I do get both subscribers, excuse me, and dependents when I search, but I'm going to go ahead and select my subscriber here. And here is where we see all of that history information, and the same silly thing that was happening yesterday is still happening. So we need to look into this a bit more. But for those of you who are used to seeing this information in the SEB audit tool, benefits reporting tool, whatever you may call it, it is all of the same information. It is a little bit more condensed. We don't have quite such a long screen, but you can come in here and let's look at eligibility. We can see what agency they were determined eligible with, that eligibility effective date, eligibility type and reason, when their eligibility was created and who created it. We did have wonderful requests come in yesterday to say, can you please tell us what this eligibility type and eligibility reason means? Because for new BAs or even SEB benefits administrators, these codes really aren't going to mean a whole heck of a lot. These are pay one codes, as we know. So we do already have that request documented to provide more information in these fields than just codes. But I can't show you the enrollments because of this broken wheel right here. But we can look at, for example, that partnership start date that we entered. We can see the history of that, if there's been changes, if there's been, changes to an address. If we had special open enrollments, we would see those listed here. Any changes to attestations. Of course, we could see any login history anytime the subscriber had actually logged in. And we also, we already have the request officially from Alyssa came in yesterday. This HCA administrative notes right now would display if a benefit admin logged in. Benefits 24/7 is not actually out there in the world for everybody to see. So we did get a request to make sure that these HCA notes do not show for benefit admins. So we will be talking through that and seeing if that's something that we can accomplish before Benefits 24/7 goes live. However, us as HCA staff, when we come in here to look at the history of a subscriber account, we can see those notes that anybody else has put on the account, just like we can in Pay One today on the 58 screens, just like we can today in SEB My Account and account corrections, we can see those notes. So really this shows us all of the actions, all of the changes that were made on an account. If this person had been enrolled and terminated and then determined eligible again, we would see multiple eligibility lines in here. This really is that history of what's happened on the account. Thank you, Amy, for reminding me of this. Are there any questions on the subscriber history?
This is Tila. I have a question.
Yeah.
On the notes, are there any rules or guidelines of what can or cannot be included in the notes?
We definitely don't have anything defined. I am aware that I know customer service for retirees and continuation coverage, they have some pretty strict guidelines on what staff write. But as far as does the system, no.
And in the history, is there a way to look at any type of correction, like name changes, social security number changes in the history?
We do not have those displayed on the history in benefits 24/7.
Is there a way for us to make that request?
We can definitely take that down and see about adding that. Certainly.
Thank you.
Welcome. I myself have had some struggles with that in my account, so I definitely appreciate that note. Any other questions on the history? Okay, James, I am ready for your question.
Yeah, when you're selecting an agency way at the very beginning of the process today,
Yeah.
where you were talking about the PEB and SEB, filtering buttons. If you pulled up an agency like Northeast Washington Educational Service District 101,
Mhm.
they have both PEB and SEB. Would it be, and they're not the only one like that, but would it
Right.
be advisable to have some kind of a flag that comes up just to make sure we're not enrolling people to the wrong organization? I mean, maybe it would be obvious, but it's Northeast spelled out.
Okay.
WA, Northeast WA. Yeah.
So I see them in SEB. I do not see them in PEB in here.
Amy, this would be like a 601 AOO agency.
It's
Correct.
because in PEB, they're just ESD. They're not educational service district.
Mm.
So if you put in 101, you'll see more than them, but you'll see both of them. There you go.
And so if we were to look like this.
We just end up every year finding people who were, another example of that one's unique because it's, PEB and SEB. The other ones that we end up with, and oftentimes it's retirees who are enrolled incorrectly. But like Evergreen School District,
Yep.
we have several same name districts.
Yep. 205 and 114. Yep.
So if we're keying a retiree into that, different training group, but is there anything that, like, I guess they both come up, and so you should know that you have to pick one thoughtfully. So I don't know how to.
Yeah, I don't
This
I
feels
know
like
that
less of an issue because they would consciously have to know that there are two different ones. But if you had it filtered for SEB or PEB, you might with the ESD issue. And I don't know that the names that were those renamed because they used to be the same name. Like the shortcut name with the ESD that Jeff suggested. The names we're working off of are the ones that came out of Amy's database.
Right.
And they're the same name.
Yeah,
but maybe they
I'm not
changed somewhere along the
sure.
way. So
Yeah, I'm not sure where the naming convention came from, but we can double check on that. I did just recently have a conversation with Amy about the data from her database for PEB organizations is obviously the system of record. So we will be making sure to cross-reference all of that data before we go live.
Okay, thanks.
Thank you. Any other questions? I'll give you guys some time back.
Is it, Amanda, is it possible to get copies of the recording from the customer service training?
Yes, so all of the recordings will be posted. I am working through that, so even all of the sessions, we will make sure that those are posted and available. I'm not 100% certain where they're going to be posted yet, but I will be working with Christy Snow, and she will make sure that those links are distributed to everybody. So you all will have access to both the active employee and the customer service retiree and continuation coverage presentations.
Cool. Thanks.
Yeah. All right, I will be here. I will hang out until everybody's gone. So if you want to ask questions, please feel free to stay around. Otherwise, thank you all. Have a wonderful day, and we will see you next week for the second part of training. Thank you. Have a wonderful day.
Thank you, Amanda.